All right, so today we're going to dive into something that's been making a lot of noise lately. Anthem Blue Cross Blue Shield tried to make a pretty big change to how they cover anesthesia, but then, well, things got interesting. They had to back down. And honestly, it's kind of wild how this whole thing might be a glimpse into where healthcare is headed. We've got a ton of articles and research you send us, so let's see if we can make sense of it all.
You know, it's fascinating how something as specific as anesthesia coverage can suddenly blow up. And it's like
Yeah.
suddenly everyone's talking about these deeper fears we have about healthcare.
Right. Like, it's not just about going under for surgery anymore. Anthem basically wanted to put these time limits on how long they'd cover anesthesia, no matter how complicated the surgery is or how long it actually takes. And they were going to start doing this in Connecticut, New York, and Missouri pretty soon, like early next year.
Yeah, and that's where it really throws a wrench in the whole way we usually think about anesthesia. Normally, they figure out how much you need based on what the surgery is, if there might be complications. And of course, the anesthesiologist uses their judgment, right? Anthem was basically saying, nope, time's up, whether you're good to go or not. So, of course, people started worrying about patients getting stuck with huge bills. And even worse, what if the anesthesia gets cut off before it's safe?
Oh, for sure. And you can't forget the internet just went crazy with this one. I mean, those memes about patients waking up mid-surgery and having to swipe their credit card to go back to sleep, hilarious, right? But also kind of scary to think about.
Yeah, sometimes humor is how we deal with stuff that's actually kind of messed up. But if you look past the jokes, there's this deep distrust of insurance companies that's been building up for years. Like, they care more about making money than taking care of people. And let's be real, it's not like this distrust came out of nowhere. We've all seen the crazy costs, the confusing bills, and the feeling like we have zero control.
It's like death, taxes, and a medical bill you'll never understand, right?
Exactly. So when Anthem comes in with these time limits, it just felt like, here we go again, the system's screwing us over.
Yeah, and it wasn't just people complaining online. Some big names stepped up pretty quickly. Governor Hochul in New York, she was like, nope, not happening, and called Anthem out publicly. And in Connecticut, there's this guy, Sean Stanlin. He's the controller. He's in charge of state employee health plans, and he was getting tons of complaints. So he basically told Anthem, get your act together. It's not every day you see politicians jump on a healthcare issue this fast.
What's interesting is how they each did it. Hochul, she's got the power, so she basically told the state regulators to investigate Anthem. Scanlon, he used his platform to be like, hey, everyone's freaking out, and this could cost Anthem a lot of money. So it was this combo of like public pressure, A&D political muscle that made them change their minds.
So are you saying the memes didn't actually do anything?
Oh, the memes definitely showed how people felt, for sure. But it was probably the threat of getting investigated A&E losing money that really scared Anthem.
Makes sense. So what did they say when they finally caved? Did they admit they were wrong?
Their statement was kind of weird, actually. They said they were just trying to, quote, align their practices with clinical guidelines, which sounds good, right? But it felt like they were just trying to sound all official and medical to avoid the real issue.
Hang on, clinical guidelines. What even are those?
So basically, they're like recommendations from medical experts based on the latest research and best practices. Kind of like a guide for making decisions about treatment and stuff like this, anesthesia coverage. The problem is, they're not meant to be strict rules. It's up to the doctors and nurses to actually use those guidelines, with each patient, because everyone's different and you can't just treat everyone the same.
So Anthem was basically using those guidelines as an excuse, like we're just following the rules. But healthcare isn't always so black and white, right?
You got it. And because they tried to make it so simple, it just made people trust them even less. Everyone saw it as putting profits ahead of patients, like they don't actually care about us.
And remember Marianne Udo-Phillips. She used to work for Blue Cross Blue Shield, making these kinds of decisions. And she actually said she was worried for her own safety after all this because people were so angry.
Yeah, that's a little creepy to think about. Like, it shows how deep this anger goes.
Yeah, even the people inside the system are getting nervous. Makes you wonder, is this going to be the new normal, this level of rage over healthcare?
It's a valid question, especially when you consider what else has been happening lately.
You're talking about the UnitedHealthcare CEO, right?
Yep.
The one who was assassinated. And it's a horrible thing, but it did happen right around the same time as all this Anthem stuff.
Exactly. And while it's important not to jump to conclusions, the timing of those two events definitely made people even angrier and made them wonder if there was a connection.
Yeah, I saw some pretty disturbing stuff online. People were saying things like these cost-cutting measures were literally putting lives at risk.
Yeah.
And that someone finally did something about it, which is really scary.
And that's where things get really dark. I mean, we all get frustrated with healthcare, but violence and threats are never okay.
It's a reminder that this isn't just a theoretical debate. This is about real people's lives, their health, their families, their financial security.
Yeah.
When you threaten those things, people are going to react, and sometimes those reactions can be scary.
It feels like all this anxiety and anger and distrust has been building up, and now it's starting to explode in ways we didn't expect.
So we've got this seemingly simple policy change about anesthesia, and it's unearthed this whole mess of issues. People not trusting insurers, social media going nuts, and even the possibility of violence.
Yeah, it's a lot to unpack, and it's not over yet. Anthem might have backed down this time, but the reasons why this all happened, those haven't gone away. I think this whole thing with Anthem really shows how messed up things are between people and the healthcare system. Like, nobody knows who to trust anymore, and everyone feels like companies just want to make money.
I was going through all this stuff you've sent, and it was interesting how Anthem kept saying they were just using data from, like, the government, the Centers for Medicare and Medicaid Services, CMS, to justify those time limits. Like, hey, it's not just us. The data says so. But is that really a good enough reason?
It's definitely a way to make it sound like they're being objective, all science-y. But the thing is, in healthcare, you can't just look at numbers and forget about the actual people. Data is important, but you got to think about each patient, each situation, not just some average.
It's like trying to say everyone should wear the same size shoe.
Lee.
It's just not going to work.
Exactly. And anesthesia is super complicated. You can't just be like, okay, this surgery usually takes this long, so that's all we'll cover. What about people who already have health problems or complications during surgery, or even just how their body reacts to the anesthesia? Everyone's different. That's where you need actual doctors and nurses, their experience, their judgment, not just some computer program spitting out numbers.
Totally. You can't just replace humans with algorithms when it comes to our health.
And that's what felt so wrong about Anthem's approach. It was like so impersonal, like they were just treating people like transactions. And that just adds to this whole feeling that nobody trusts them anymore.
Like we're just cogs in a giant machine, not actual people.
Yeah, exactly. And it can make you feel so powerless, especially when you're already dealing with being sick.
So back to the whole social media thing. It's kind of crazy to think that a bunch of tweets and memes could make a company as big as Anthem back down. I mean, what does that say about how powerful public opinion is now?
It shows how things are changing, how people can use social media to actually hold these big companies accountable. We're all connected now, so we can share our stories, our anger, our demands, and it can actually make a difference. It's like a new kind of activism.
And it happened so fast, too. This whole Anthem thing blew up and then was over in like a week.
That's the thing. It's amazing how quickly information spreads now, how quickly people form opinions. But it's also kind of scary because it can also spread lies and hate.
Yeah, it's like a superpower we haven't quite figured out how to use responsibly yet.
Exactly. The same tools that can help us can also hurt us.
Speaking of which, you mentioned earlier about the UnitedHealthcare CEO, Brian Thompson, and how that whole thing, the assassination, made everything even more complicated.
Yeah, it's a tough topic. But
Yeah.
it's hard to ignore that it happened right when all this Anthem stuff was going down. I mean, it shows how dangerous things can get when people's anger and frustration reach a boiling point.
Like, it's not just about insurance policies anymore. It's about real fear and violence.
Yeah, and while we can't say for sure that those two things are connected, it does show what can happen when people feel like the system is broken and nobody's listening to them.
Okay, so we've got this Anthem policy, people freaking out, social media blowing up, and then this act of violence. It's a lot to take in, and honestly, it's pretty disturbing.
I get it. It's easy to feel overwhelmed by all this negativity. But even in all this mess, I think there's some good things happening too. Like, this whole thing with Anthem shows that people actually care about healthcare. They're not just going to sit back and let companies make decisions that hurt them.
So it's a sign that we're not giving up, that we're still willing to fight for a better system.
Yeah. It reminds us that we have power, we have a voice. We can demand that companies and politicians are honest with us, that they prioritize our health, not just their profits.
So what can people actually do if they want to get involved? I mean, tweeting is one thing, but what about real action?
There's so much we can do. And it doesn't have to be super complicated. First, just stay informed. Learn about what's going on. Talk to your friends and family about it. You can research healthcare policies, contact your representative, support organizations that are fighting for change.
And what about choosing to support businesses that, actually care about people? Like, if I hate what an insurance company is doing, can I just switch to a different one?
Totally. Those choices matter. It's about putting your money where your mouth is, showing companies that you're paying attention and that you care about how they act.
It's like voting with your wallet, right?
Exactly. Every choice we make, even the small ones, they all add up. And when enough people make those choices, it can really force change.
So it's not just about complaining online. It's about being informed, being intentional with our choices, and using our power as consumers and as citizens to push for a better healthcare system.
Yeah, and it's about remembering that we're not alone in this. We're all in this together, and if we work together, we can actually create a system that works for everyone.
That's what gives me hope, this idea that we can actually make a difference.
It's true. And it's that hope, that belief in collective action that we need to hold on to as we try to fix this broken system.
So we started talking about Anthem and their anesthesia policy. And now we're talking about the whole future of healthcare. It's crazy, right? We started with this one thing about anesthesia, and now we're talking about the whole healthcare system.
It just shows you everything's connected. And these decisions that seem like just, paperwork and policies, they actually have huge consequences for real people.
Yeah, no kidding. So we've talked about all the problems, all the frustration, all the fear. But what about solutions? Like, where do we even start? It feels so big, so overwhelming.
Healthcare is a mess, that's for sure. And there's no easy fix. But that doesn't mean we should just give up. Actually, I think this whole Anthem thing, it kind of shows us what we need to do.
Really? Okay, I'm listening.
First thing, we need transparency. Anthem trying to hide behind those, what were they called, clinical guidelines, without actually explaining anything. Big mistake.
So basically, insurance companies need to be more upfront, explain their policies in plain English, and actually talk to people, not just dismiss them.
Exactly. And it's not just insurance companies. Doctors, politicians, drug companies, they all need to be more open and honest.
It's like we need to understand how the system works. Because right now, it's like this big confusing maze that nobody can figure out.
Right. And that brings us to the second thing, accountability. Remember how quickly those politicians in New York and Connecticut jumped on this? That shows they can be held accountable, that they have to listen to people.
So it's up to us, the voters, to make sure they actually prioritize healthcare, not just use it as a way to get votes.
You got it. We got to stay informed, talk to our representatives, vote for people who actually care.
Okay, what about social media? Is it actually helpful or just a place for people to yell at each other?
Honestly, it's a bit of both. It can spread awareness like it did with Anthem and help people organize, but it can also be a breeding ground for fake news and hate.
So how do we use it for good without getting sucked into the bad stuff?
I think it comes down to being smart about what you see online. Don't believe everything you read, check your sources, and don't get caught up in the drama.
So basically, think for yourself and don't just react emotionally.
Exactly. And remember, online activism is great. But don't forget about the real world, voting, volunteering, supporting organizations.
Okay, so we've got transparency, accountability, and being smart about social media. What's the last piece of the puzzle?
I think it's remembering that we're all human. Healthcare is about taking care of each other, about helping those who need it. But it feels like we've lost sight of that. It's all about money and politics now, and everyone's fighting each other.
Like we've turned healthcare into a war zone instead of a place for healing.
Exactly. We need to change how we think about it. Healthcare should be something we all work on together, something that reflects our values as a society.
That's a good point. So it's not just about rules and regulations. It's about how we treat each other.
Yeah, and it's about recognizing that everyone deserves good, affordable healthcare, no matter how much money they make, where they come from, or where they live.
We started with anesthesia, and now we're talking about the soul of healthcare. Wow.
See, it's all connected. It all comes down to people's lives, their dignity, and what kind of world we want to live in.
Well, this has been quite the journey. Honestly, I'm feeling all sorts of things right now, angry, hopeful, a little overwhelmed, but also inspired.
That's what it's all about, right? Facing these tough questions, feeling the emotions, and then figuring out what we can do.
So to everyone listening, what are you taking away from this? What questions are sticking with you? And most importantly, what are you going to do about it? Because even small actions can make a difference. The future of healthcare isn't something that just happens to us. It's something we build together.